Hello, doctor.
Yes.
So we have to, we are the one like go for the, okay.
Yes.
Okay.
That's fine. You can just present what you have done so far. That's okay because I know the time is limited. But let's see what you can come up from that article.
Just Yin, can you share the slide?
Are you seeing my slide? Hello?
Yes.
Can you hear me? Can anyone hear me?
Yeah, we can hear.
You're looking at our slides, right?
Yeah, we can see now, yeah.
Okay. So, Sana, maybe, because we haven't discussed yet, finished, Sana, maybe you can do the minimizing adverse effect part. I mean, present. At the concluding, I will start with introduction and this pharmacodynamic and application. Okay, yeah.
Okay.
All right. Okay, good morning, doctor. So today I'll be presenting on the pharmacogenomics effects on diabetes mellitus therapeutics. So first of all, we have to understand what is diabetes mellitus. So in this article, we are looking at mainly at type 2 diabetes mellitus. So type 2 diabetes is a complex metabolic disease characterized by hyperglycemia. I think most of you has already known or heard about this disease already, in which it is results from impair of insulin secretion or insulin action or both. So glycemic control, the main focus is to control the type 2 diabetes is the main focus is to control the glycemic index. However, this approach usually fails because of the available treatment options that we are having now and the progressive nature of the disease. So here is the image of what the treatment options are available in the market nowadays and the mechanisms of actions as shown here. So next is, so what are the application of pharmacodynamics in type 2 diabetes mellitus are as shown in this blue box. So first of all, let's look at the impact of this diabetes mellitus drug response on pharmacogenomics. So previous candidates genes studies has largely focused on drug transporters or metabolizing enzyme variants. So there are more pharmacogenomic studies are more looking at how this drug was transported or metabolized within our body. So here in this article, they have shown many examples, and these are the examples that I have already collected. Here, drug metformin with this genetic variation will cause impact to the drug metabolization in this many different patients, and sulfonylureas with these genetic variations will have reduced drug response. With these genetic variations will have increased drug response, and TZD has a poor, if you have these genetic variants, we have poor response. So I cannot see. Yeah, so next is how this therapeutic drug response could actually help us apply to finding a new technologies or new therapeutic agents, is that because previous study on GWAS data has already identified these variants near at this ATM locus, and it shows that this variant has associates with glycemic response to metformin. And although these studies has no showing the variant has no functional link to any metformin mode of action. However, this study has demonstrated how this pharmacogenomic discovery can reveal a novel mechanism of action of the anti-diabetic drug metformin, and this in turn can help us identify further pathway to target with new and therapeutic agents. Yeah, that's all from my side.
Yeah, thank you, and thank you. My part is gonna minimizing adverse effects. So how the genomic or pharmacogenomic helping with the minimizing the adverse effects of the drugs. So the one that we just point out from the study, it was metformin, the one that the drug used for the for the diabetic patient mostly. The role of the pharmacogenomic in optimizing therapy selection and minimizing the adverse effects, it goes to the studies like into the studies with the identifying genetic risk factor firstly, and then elucidating the genetic architecture of adverse effect responses from the patient, and leveraging large sample size, utilizing genetic evidence to validate drug targets. So if we have the validated drug targets, so we know the outcome of that drug, and adapting systems biology to know the complex biological mechanism goes under this drug interaction with the cells, to understand the complex biological networks involved in drug response within the body. So with the help of all the genomic information, pharmacogenomic help with the minimizing the adverse effect and optimizing the selection of that therapy for the patients. So here we have three drugs that we selected: metformin, sulfonylurea, and thiazolidinoid. Sorry for the mispronunciation. So they have they have their adverse effects. With the help of the finding out for that genomics related to the adverse effect, so it will help with the avoiding or minimizing these adverse effects due to the drugs. So concluding remark, the availability of the affordable high-throughput genomic technologies has expanded our knowledge about the multifactorial etiology of the TD diabetic type 2, facilitating a more efficient anti-diabetic drug discovery program. So with the help of this new era, with the pharmacogenomic helping out with finding the drugs with more efficient and less adverse effects. Thank you so much, Doctor.
Okay, thank you very
Okay,
much.
doctor.
That's very good. Yeah, Ian, you want to add anything?
No, shall I stop sharing, or do you still need this slide?
Yeah, we still need it. Do we have any question from the rest? You can also ask your friend who are presenting, okay? I have one question. You mentioned, Sana, you mentioned about the systems, adopting a systems biology perspective to understand the complex biological network. So what are the examples of the other components included in systems biology when it comes to the treatment of diabetes? Can you give some example to elaborate on this? Do you have any idea of that? Yes.
No, Doctor. Like only like the thing they were like mentioning, like this approach can help with this pharmacogenomic studies to provide context-specific evidence on how drug alters the function and tissue, cellular, and disease stage level, helping to predict and minimize off targets. It all goes to the minimizing the off target of the drugs, and to exactly finding the drugs for the exact target, not like off targeting, because the adverse effect and the adverse effect it comes from the off targeting the side effect of any drug. So just like finding the real interaction between that drugs component with the receptor and the target that they designed it for, minimizing off target mostly.
Okay, all right. Okay, one question for Ian. You mentioned about the GWAS RS112 just now, right? I'm just curious, where is this? Is it like the gene? Is it for a receptor, or is it for a protein? Which type of protein, if you can recall?
Doctor, because
Yeah.
the study was just one sentence. So like really from the review itself, we don't get what is the receptor or what but it
Oh,
is on
okay.
this ATM locus. If I have time, I can go to this 39 reference to look
Okay,
at
don't
what
worry,
is the
don't worry. I'm just wondering what
yeah.
is that?
Doctor,
Okay.
I can answer this one. It's
Mm-hmm.
yeah, this variation it's went to the transporter.
Transporter protein.
Yeah.
Okay, all right. Thank you.
Thank you.
Okay, thank you very much. Group one, that's very good. Okay, can we have group two? Group two, we have Rad and Song. While waiting for them, can you all? Yeah, I can see your screen, but then I did not see any
Cannot
slides.
see the slide. Cannot see. Okay.
Yeah, I cannot see the slides. Okay, while waiting for Song to upload the slides, can you all upload your slides on the Padlet? Okay, so that we can, everyone can have a look as a reference.
Can you see the slide now?
Okay. On my part, it's still
Cannot see.
blank. It's still like white blank. I'm not sure whether it's because of my internet.
Red, can you show the screen?
Send the screen, I can share.
Yeah, you share.
Okay. Wait. Okay now, Sonia?
Okay.
Okay.
Oh, I cannot see. You stop.
Now,
Cannot see. Okay.
okay now?
Okay, can see.
Yeah.
Good morning. Our group project is pharmacogenomic biomarkers and their application in psychiatry. I will discuss the first part, application of pharmacogenomics in personalized medicine. First part, the impact of genetic variation on drug response. Genetic variations in enzymes such as CYP2D6 and CYP2C19 significantly affect drug metabolism. Different metabolic types can affect the efficiency and safety of their antidepressant and antipsychotics. Second point is drug target receptors. Genetic variation affects the binding effect of drugs to targets. For example, the difference between SLC6A4 and DRD2 genes can affect the efficiency of drugs for depression and for depression. Last point, adverse reactions. Genetic difference can increase the risk of drug adverse reactions. And genetic variations such as HLA-B are associated with the risk of severe skin reactions associated with the anti-phosphatic drug carbamazepines. Second point is optimized treatment options. About personalized treatment plan, pharmacogenomics testing can develop personalized treatment plans based on individual genetic information, select the most suitable drugs and doses, and reduce trial and error. About reducing side effects, identifying
genetic susceptibilities can avoid the use of drugs that may cause serious side effects, especially in psychiatry, which has a significant impact on patient compliance and the quality of life. It also can improve treatment efficiency. By adjusting drug based on genetic information can improve treatment efficiency, such as determining patients who have a better response to specific antidepressant through genetic testing. And the second part, Red. Red?
Okay, thank you. The role of the Bahar emergency optimizes the treatment, reduces adverse reaction. To have the two-part, optimize the treatment, reduces adverse reaction. Optimize the treatment, the genetic test available that patient with the describing CUB2D6 also metabolism, the doctor can choose the drug using define the metabolism patient available efficiency toxicity. Algorithm guide the precision utilize pharmacy data issue clinical decision making reduces the time and the choose associated with the efficiency treatment available reaction role available advanced reaction uh, prevent measurement and continuous monitoring. The genetic test can identify high risks available before medication, such as screening HLA-B Asia patient to available to use the compromised and prevent skin reaction. Continuous the monitoring integrate genetic data in the patient monitoring system, adjust treatment patient roll time and the immunity long term safety and the efficient. Thank you.
Okay, thank you very much, Song and Rad. But I think topic 2 is cardiovascular, right? Isn't it? But you're doing psychiatry. How about Gao and Tapa? Did you do psychiatry or cardiovascular?
Psychiatry.
Psychiatry as well.
Yeah.
Oh, okay. Right, and Song, I think you have mistakenly took the topic, but that's okay. That's okay. We just have a look at the points that you can take up from this article. From the concept, the impact of genetic variation drug response, I think Song has mentioned about that that is fine. But then Song, maybe you want to give example of the medications for antidepressants and antipsychotics, and what would be the genetic variation if you can screen from the article. Just one example.
One example about the genetic variation.
Yeah, genetic variation or gene. If there are any gene that is related to the response, the gene is going, the variation in the gene is affecting the response to antidepressants, for example.
About such as CYP2D6 gene variation, it can affect the metabolic rate of drugs.
Okay, it's related to the metabolism of the drug, right? But then if you go through the example, if you look at the table, right, of the article, yeah, most of it is actually the enzymes. Most of it is enzyme. But then in the article, there is also mentioned the serotonin transporter gene, okay, SLC6A4. And I think you also mentioned that before, right? So that would be related. Yeah, that would be related to the drug response because that's where the action of the drug is. Okay, Rad, you mentioned about HLA-B 1502, right?
Yeah.
That one, yes, it is a very significant marker, but that is for anti-epileptic.
This
Um,
test,
mm,
this test used the Asian people,
yeah.
yeah, prevent the reaction with the reaction skin after
Mm,
using this treatment.
yes, correct. So it is a marker for adverse drug reaction, and it is significant for Asian patient. So this marker is not actually a marker for Caucasian. It is specific for Asian population. Mm,
Yeah.
okay. What do you mean by genetic testing? Your first sentence, genetic testing revealed that a patient with depression is a CYP2D6 slow metabolizer. What do you mean by this sentence?
Yeah, the genetic testing take the idea about the doctor. You can choose the treatment about the
Mm,
specific diagnosis and specific treatment. This help the doctor for diagnosis for describe of the treatment for in patient.
yeah.
More patients die because not a specific correct. This test you can use it a specific diagnosis and a specific take the treatment.
Mm, yeah. Be careful when you say diagnosis because this is not for diagnostic. Okay, pharmacogenomics is not for diagnostic. It is actually to optimize treatment. So the doctor will
Yeah,
do the diagnosis first for the disease. So diagnosis is for the disease, but the pharmacogenetic marker is for the treatment to manage, to improve the treatment. Okay, but then your sentence here is actually confusing because you said genetic testing revealed that a patient with depression is a CYP2D6 slow metabolizer. So later you please correct this sentence if
this
I
use it for
understand.
test. This use it for this test the treatment.
Yeah. I get what you mean if you explain that. But your sentence here, if I read it like this, it says that anyone with depression, they are all slow metabolizer. You don't mean that one, right? That
Okay.
is not what you mean, right?
Okay.
Is it right?
Yeah.
Yeah, so just the rephrase the sentence because now it is misleading. You say that all patients with depression they are all CYP2D6 slow metabolizer. It's not that way, right? For
Mm.
patients with depression, if you know that this patient is CYP2D6 slow metabolizer, then you need to match it uh, with the suitable antidepressants. Those antidepressants that are not affected by CYP2D6, for example. Okay, or adjust the dose accordingly. All right. Thank you very much,
Thank you,
Song and
Doctor.
Rai. Okay. All right. So we come to the next group, Gao and Tapa, also secretary, but it's okay. Let's see what you can come up with. Can you Rad, can you unshare your slide first so that others can share their slide?
Okay, Doctor. Thank you.
Hello, can you all see my slide?
Yeah. So I should call you Pushpa, right? Instead of Tapa? Is
Call me
Pushpa your
Tapa.
first name? Or Tapa is
Yes.
your first name?
Pushpa is my first name.
Oh, Pushpa. Okay, sorry. Okay, can you continue?
Good afternoon, doctor. Good afternoon, guys. So, so today's my group, my partner is Gao. So our topic is pharmacogenomic biomarkers in psychiatry, personalizing treatments. I'll be talking about the first half part, and the remaining half part will be done by Gao. Psychiatry. So it is the diagnosis and it is about the diagnosis, treatment, and how we can prevent about the mental disorders. So who stated that about 25% of the population they suffer from mental disorders in life. So not like we are not really sure what causes it, and then medication. And then medications, there are available medications for mental disorders, but not all of them work in a similar way to every individuals. So, so now it is known that not only the environmental factors, but also the gene of an individual plays an important role in this disorder. Biomarkers, these are the measurable indicators of some biological state or conditions in our body, so which can be used for different purposes. As I told earlier, like the drugs, they don't respond in similar way to everybody, so every individual responds in a different way. So, due to the genetic variations, the drugs which are used for the mental disorders, hello, hello, hello. Can you hear me?
Yeah, we can hear.
Okay. So, as I mentioned, not all individuals respond in similar ways. So, one of the reasons for this is the variation in our genes. So, due to this, the genes plays different role. For example, in the metabolism of drugs. For example, for the antidepressant, various enzymes that they are responsible to metabolize these drugs. But some people they have enzymes such as the CYP26, which breaks down the drug in a very slower process. And then another one is due to the gene, there is some issues in the transport of the drugs. And then another one is like targets, for example, SLC6A4. This is a serotonin transport gene. So which is used to predict the response to the SSRI. The genetic variation in this gene leads impacts the efficacy of the drug that we use. Now I'll like Gao to do the further remaining parts.
Okay, Gao, are you there? You can continue.
Yeah.
Gao, you can continue.
Hello?
Yes, yes. You can continue.
Yes. For the background, the World Health Organization estimates that about 25 of the world's population will suffer from at least one mental illness in their lifetime. Depression and anxiety are the most common uh, disorders and can affect people of any age, gender, race, and race or background. There are some differences in drug treatment and individual response. Medicine obviously can be used to reduce the symptoms or disorders, but patients' response to uh, medications for various physiatric disorders can vary widely. It depends on the individual health risk factors. The pharmacogenetics are very important. Pharmacogenetics studies the relationship between drug response and individual genetic variation. More and more drugs are being tested for pharmacogenetics before used to help choose the right drug or dosage. The need for pharmacogenetics testing. Some drugs are only effective for specific genotypes, and testing can avoid unpredictable theories and potentially fatal drug reactions. Example, carbamazepine repairs the PGX test of HLA-B because patients with this variant are going to develop several skin reactions. Drug levels include not only standard dose informations but also dosage adjustments or drug selection guidelines decide on the patient's genetic makeup. Thank you.
Okay, thank you very much, Pushpa and